Hi, this is Manoj Abraham.
And this is Babak Azizzadeh, and we are here to discuss our upcoming publication, Complications Associated with TXA Use with Cutaneous Flap Surgery. So, Manoj, what was kind of your, desire to do this study? We had been talking about it for a while, but maybe you could fill us in.
Yeah, for sure. So, I've been using oral TXA in my practice for many years because, as you know, it's got a known efficacy in reducing perioperative bleeding. It's been reported in obstetrics, orthopedics, and trauma surgery. And there is certainly a growing body of literature advocating TXA use in facial plastic surgery. So I was involved in a multi-institutional split face rhytidectomy study and was really impressed with the reduction in postoperative bruising with TXA injection and topical application. This is underneath the skin flap. However, shortly after using TXA in this manner, I had a few patients develop flap necrosis in an unusual pattern in the mid flap, which I had not seen before. I then began to hear anecdotal reports from other surgeons experiencing the same concerns, some with much more serious wound healing outcomes. We therefore decided to survey plastic surgeons and facial plastic surgeons across the country to determine if others were noting any issues, any similar issues with TXA use.
That's awesome. Can you give us a little brief summary of the findings of the study?
Yeah. So we had 381 respondents providing a response rate of 9.4%. 275 surgeons reported routinely using TXA during cutaneous flap surgeries, and a total of 121 complications were reported felt related to TXA use. Interestingly, 117 of these complications were in cosmetic long flap surgery. These are flaps greater than 2.5 centimeters. The most common complication, 67.9% of the time reported, was flap necrosis in an unusual pattern, again, mid flap. 62 patients had scarring. 26 patients had unmanageable scarring, not able to be hidden or camouflaged easily. And 4 required prolonged medical therapy, such as anticoagulation, and 2 unfortunately resulted in litigation. There was no significant correlation between modality of TXA use and complication rate.
That's just unbelievable. Pretty interesting data. So, what's your overall takeaway from this study?
Yeah, so although TXA clearly has a beneficial effect in terms of reducing postoperative bruising and drain output, it certainly must be used with caution, especially with long cutaneous flaps. It's possible that there is a dose-dependent mechanism of action. For instance, when combining oral TXA with injection and topical application under the flap, like I was, or perhaps direct exposure of the subdermal plexus to TXA may predispose to clotting. This clearly requires further investigation and study to elucidate. What are your thoughts on this, Babak?
I mean, I think, I just was published in another journal, a small anecdotal, group of patients between 3 different institutions, small number of flap necrosis. It was the same thing. I mean, I've been in practice for 20 years, and I generally, of course, for this study, 2.5 centimeters was considered, anything more than that, long flap. But, in facelifts, typically speaking, long flaps can be 7, 8, 9 centimeters. I've always used kind of, either a deep plane approach or, a SMAS imbrication using very short skin flaps. So really in 20 years, I've never had any real flap issues, necrosis issues. And as soon as I started using, again, I rarely use IV actually, which I think has been proven correctly. But as soon as I started using the injectable in my tumescent, there were a couple of patients, within a few month period of time that had a very unusual process. So I my practice pattern has changed, and now I'm really focused on, I do use it topically. And if the patient is bleeding a lot, I'll give IV, but never in the injection.
It's an excellent point with composite flaps. These are really well vascularized flaps, not prone to these types of issues, especially non-smokers. And so it's surprising what we're seeing, and clearly we're for the investigation because we don't know exactly what's happening. And so just a matter of getting the word out to everyone about just being cautious in this situation.
Absolutely. Well, thank you, Manoj. I really appreciate it, and looking forward to seeing the paper.